It's a beautiful day and welcome to another episode of Straight Talk with Eunice Felicity on food and health communication. It's a new month, as we all know, and this wonderful month of May has been giving us different start of vibes, like the Workers' Day, which was celebrated on Sunday, which happened to be the first of this month, and today, the 5th of May, we are celebrating the International Midwives Day. Whoops! Guess what? Today, the International Confederation of Midwife, which began as the International Midwife Union in Belgium, turns a century today. Now tell me, what better theme for the International Day of Midwife than 100 years of progress? I think they deserve accolades for that. Alright, since 2008, when the Global Midwifery Program was established by the ICM, which represented more than 1 million midwives worldwide, UNFPA has supported the work of midwives in more than 120 countries. We've seen them perform their duties in the face of climate change. We've seen them perform their duties in the cases of war. We've seen them help women give birth safely as electricity flickered, flood waves rose. And midwives have put their lives at risk and helping expectant mothers during the COVID pandemic and the Ebola outbreak. They've turned their homes, where 50% of health facilities are operational, into makeshift maternity wards. They've provided care for refugees, such as we see in the Russia and the Ukraine war. And also they've worked under the threat of militant group, like in MAIDUGURI, a northern state in Nigeria, West Africa, facing terrorism. What do we think about when we hear the word midwife? I know a lot of us would immediately say childbirth. Yeah, you're right. That's the first image that pops up into your head. But these guys do much more than that. In addition to provide antenatal, interpretum, and postnatal care, they provide family planning. Yes. They also give services like breast cancer and cervical screening. They can also perform basic emergency obstetric care when needed. With counseling and information, they can help prevent female genital mutilation. You see, they are much more than just childbirth. And that is why we have one of them here with us in the studio in person of Mrs. Violet Ofo. Welcome, Mrs. Violet, to our studio today.
Thank you very much.
Yes, she has been a midwife for over 23 years now, and she's here to give us so many informations that we need to know about midwives and their operation and how they operate in the system. So, Mrs. Violet, how do you feel being here today with us?
Thank you. I feel excited. I look at it as a privilege
to
come and talk about midwifery.
So, how long have you worked as a midwife in?
I've worked as a midwife over 23 years now.
23 years?
Yes.
So, what kept you?
It gives us joy.
Okay.
Because seeing you helping God to accomplish what God has started, and seeing a mother and a baby and the children going along the street, you see many children you have delivered, and that's expecting that I'm still going to deliver more. And everybody like it, and you like it, and you see people enjoying your profession, and people calling you to come and assist and give the health talk and participate in one way or the other concerning the profession. This gives us joy to continue for the work.
Wow, that's amazing. Like being in a work environment, if you don't have joy, there's no point staying there. You get. So, okay, what inspired you to become a midwife? Like starting up in life, what inspired you?
It's a rewarding profession.
Wow.
And the rewarding profession in such a way that those children they deliver, they still and saw them clearly and saw what they are. So for me now, I say, God, I must be. In those days, we are in the village, we don't even know what is different between a midwife and a nurse.
Yes.
We're only saying, I want to be a nurse.
Yes.
I want to be a nurse. It was when we enter inside, we know that there is a difference between nursing and midwifery, though they can work almost the same.
So, in few words, can you just give us a brief summary of differentiation between a nurse and a midwife?
A midwife dealt with pregnancy, delivery, anything concerning a woman with a delivery site.
Okay.
But a nurse takes the general part of everything,
Okay.
but not specializes on the area of delivery.
Okay.
That is it.
So you're trying to tell us that a midwife can actually take all the delivery. She doesn't do any work of a nurse.
It can do, but if you come to a hospital, a midwife will go for the antenatal labor, maternity side,
Yeah.
in presently now family planning and all those sides.
Yes.
Whereas a nurse will go to the general side of taking care of, you have accident and emergency, you talk of surgeries that pertaining to general part of the body,
All right.
not for the reproductive part.
All right.
But
Okay.
a midwife see a woman with a pregnancy, with everything, you say, a midwife, this is your area.
All right. So as a midwife, I'm certain you might have had a lot of experiences with pregnant women. Now, the health facilities required to aid in delivery. Would you say we have the top-notch delivery facilities in our country?
In our country,
Yes.
no, cannot say no, because when we talk of delivery facilities, we have to start from the grassroots.
Okay.
From the grassroots, to have many women that cannot afford to go to big private hospitals or
Hospitals.
tertiary hospitals.
Okay.
But from there, we're supposed to have basic health centers.
Yes.
From basic health centers, we have primary health care. But
Yes.
in all those places, number one, personnel. In some of these places, some of these areas cannot even afford to employ a midwife to stay in that place. So
Wow.
because of that, personnel is already impaired. I will talk of the
Yes.
facilities, some of the proper instruments we're supposed to use. You
Yes.
notice that there, you don't even have many of them. You don't
Right.
even have some of them. And that's why today now you are still having issues of this woman going to deliver, died. This woman, there are some problems they're supposed to, a midwife is supposed to stay and dictate it on time. So, okay, this woman, we cannot continue with you here.
Yes.
But because there's no midwife in that place, take for instance in Nigeria today, when you see all these big primary health cares, all of them are headed by a community extension workers.
Okay.
And they are not well taught.
Yes,
on
about
that, on
midwifery.
midwifery work.
Wow.
So because of that, that is why we're having some issues of deliveries and complications we're having in Nigeria. And Nigeria cannot do more than to keep true, that's a health extension work, community health extension worker. They will allow them to be conducting delivery. The ones, they don't know when the complication is coming. They don't know what is happening, who will be the next step to take. So that's the problem. So in Nigeria, we don't have it, unless we are aiming at. And if we are going to aim at it, we are start from that basic health, that all the traditional birth attendants in the basic health centers must be well trained, at least train them with a little knowledge.
Yes.
Where they will look at it and say, no, this thing they told us, if we will see it, refer. Then in the primary health care, now that government is emphasizing women should go to primary health care and register, we have to make sure that every primary health care must have midwives inside.
Yes.
And have them as the heading the place. Because when you know that professionally I'm higher than this person,
Yes.
and that person is heading you, you can't do more than what the person said. And because of that, that's the problem we're having. The government should help us to equip some of these areas. Primary health care is supposed to have what they have. And if they notice that this work is above us, they should do what? They refer.
Yes.
So that we stop all this mess up we're having in the rural areas.
Okay, so now how can we achieve such top-notch facilities you talked about, like the experts in midwifery, the bed facilities, all the facilities in the hospitals? How can we get those top-notch facilities?
First, if personnel first have to train, even employ the one they are trained, because there's a problem in Nigeria. Even the trained one are not employed. They are roaming up and down. They are walking from one private hospital to the other. Whereas our government one is suffering because nobody employed them.
Sorry to cut you short. You know, in 2020, the United States was ranked the highest when it comes to maternity mortality rates. You know, women dying in the hospital during childbirth. United States was ranked as one of the top most. And Nigeria also was not left behind. Nigeria was not left behind. We have our own rank when it comes to maternity mortality rate. So now we can see that according to the World Health Organization, the maternity mortality rate of Nigeria is over 814 per 100,000 live births. So how can we stop? How can we stop this increasing maternity mortality rate? Because every day it's increasing. Like as of this morning, a friend of mine called me and was like, she lost her sister due to childbirth. So all these things happening, how can we stop it?
First of all, we'll start with education. And education is a midwife that's supposed to educate the public, educate the people in the rural area, educate the people in the mad. Even as we're here in Abuja, we're supposed to know, because there are some cases somebody will know. See, take for instance, a woman entered, and you look at her. I say, this woman, madam, come. This is her condition. How many months is your pregnancy or weeks? How many weeks? He say this. He say, and you are having some of these signs. No, go to DAB, go and see doctor. They know it. They start prevention. Then during the antenatal, you educate the women on danger signs. There are some signs that if you as a pregnant mother see, don't stay at home, don't listen to any other person, come to the hospital direct. Okay. So that the midwives that know about it will help you. If they cannot help you, they will refer you to the higher order.
Okay. That
will help you. So for that, then in some of the hospitals we have, there's no. You see, we lost one of our doctors because accident happened along the highway. They rushed him to the one general hospital along the road. Do you know what killed that man?
No.
No giving set. Giving set to connect the drip for him.
Yes.
And because of that, he continued after bleeding and all these things, struggling with life, struggling.
And these are little things we can get.
How much is giving set? How much is cannula? Even provision of these things. We'll come to the hospital, the mother will say, go and buy. Why? It's not what the time government is supplying. How much are they allocating in our what? In our health? Every year they say they allocate so millions and trillions of concerning health. Okay, who are using it? The hospital are lacking. Because of that, they rush you inside. You are saying, hey, go and buy. Before you buy and come,
the person is gone.
It's gone. It's very, very painful. So there are many things I will have to put on consideration for us to achieve our aim in Nigeria today. And we are still believing God. God will help us.
Amen. He will help us. So now, how do you approach pregnant women with emotional or psychological challenges? Because especially the newborn, those women that are just giving birth to their first children, you know, due to what they've heard outside, giving birth is stressful, the labor is this, you might die, and this. Those people having emotional and psychological problems, how do you approach them?
First of all, you have to come closer to the patient and know what is the cause of the either emotional or psychological.
Okay.
A woman that's delivered the first pregnancy, she have twins, and because there's no money, the husband ran away. So because of that, that woman is what? It's already disorganized.
Emotionally down.
Emotionally down. You have to come closer, ask the woman, explain everything to her, call the husband back. It's not by running, it's not like this, it's not like the other one. Or if it's underage, a single mother, this girl have pregnancy, and because he have pregnant, the parents rejected, the person that put her in that condition ran away, and it's already disorganized, telling that it is better I die. That's why we have the children they throw away on the street today. It's because of this either psychological or emotional because of financial. Yeah, no, I've already accepted that I will carry this pregnancy to term. Now I have delivered, no money for food, no place. The place is staying. The person is saying, I have accommodated you for long ago. So all these things, if government will come in at least, if it's empowerment, we'll do empowerment.
Yes.
The person will be working and have to make a living.
Okay.
Then, if it's a place that's any other problem health-wise, then we take it, say, let's treat the problem and everything will be okay.
Right.
I've seen a patient who come, I say, I want to abort the pregnancy. The doctor say, no. Just stay with us. We are going to deliver the baby freely for you as far as you agree to clinic. So, because of that, the person calm down and relax and deliver a live baby. So, when you know the cause of their problem, then you will be able to help them out.
All right. Okay, now, so the main duty of a midwife is to prepare women for delivery of new life and to also provide support and guidance during all stages of pregnancy, throughout the process of labor and also during the age of postnatal stage. Am I correct? Okay, now, why is it that these rules over the years have been applicable to just those pregnant women visiting private hospitals? Like all these rules, taking care of them, maintaining their health, treating them like, you know, they are well? Why is it that it's just in the private hospital? What about those that are staying in the government hospital or the primary health care? What happened to them? Are they no humans or what?
In Nigeria, the condition of the country is such a way that because they are not employing enough hand, a single midwife or two midwives will be taking care of hundreds or more than hundreds. I could remember in those days in Yanya General Hospital, when you come on the antenatal day, they will drop 100 numbers. If you are not lucky to come before that 101 finish, you are going home for that day. You see, if actually we have one midwife, 3 or 4 women, that person will be able to cope. You are looking at the file you are going to attend to. There are many. And these people are human beings, just like doctors. When you come to general hospital, one doctor will see more than 100 people in a day. Whereas you come to private hospital, the doctor may see only 4. And because of that, he have enough time to interact with them, chat with them, play with them. It's okay, take my number in case you have any issue, call me. Now we are in the WhatsApp age. Now the doctor in the private hospital will develop one and for all the antenatal people and say, this is our WhatsApp number. In case you have any issue, bring it up. We are going to discuss it on that our platform. You see, but in the general hospital or even primary health care, go to primary health care. Some people will come antenatal as early as before 6, before 5 a.m. to pick the number so that it will be for them. And when these people are coming, they already come here. These people are too much. Hey, am I going to attend to all of them? That's the problem, my dear. It's not that they are not human beings. They are human beings. And they're supposed to also be taken care of. But because the workload on these few hands in there is because of the problem.
So do you think the workload on these people have been the one that have been pushing them to actually like vent their anger on the pregnant women?
That is the main thing. You see, when I was in school of nursing, government provide gloves, provide everything for us. Presently now, government don't provide anything. If we are going to check you as you are a woman that is in labor, say I want to see, is it really labor and coming? The midwife will say, Mama, Madam, bring your glove. Which means if you are not with the glove, nobody will attend to you. And you cannot expect the midwife to use her bare hand to check the woman. No.
Is it even right for the segregation of just saying private hospital, and is there a need for that? Because okay, while growing up, I had this idea that everybody should be one, you know, just be together. So why not everything is together, no private hospital, no government hospital, so that these midwives that have been running down to the private hospital, they can actually attend to those other people in government hospital. Why is that so?
No, the issue is that the government is not, the government people are not employing the ones that they're supposed to employ. I went for one interview in those days. When I got to the National Hospital, they asked me, the first question they asked me, say, Madam, who gave you a letter? And because nobody gave me a letter, so we will call you back.
So
we will reach to you.
The system now is you have to know somebody before
they employ you.
That's
if
really,
not,
it's really
and that
appalling.
is why private or no private those people working in the private, they are not happy working in the private hospital because you cannot compare private with
government
hospital.
And this is actually a problem that we've been facing globally. It's not just in a particular country.
No.
This is a global issue. Now, all these things that have been happening, is it even right? Is it right, even if the midwives are facing issues from the government and they are facing problems from the government and the government are not paying them? Or is it right for them to vent their angers on pregnant women? Like, I'm coming to give birth, I'm not the cause of your problem.
You see,
so you shouldn't put that on me.
We are human beings. Everybody know how she react to issues.
Okay.
If not, the teaching from beginning is, even if you have family issue as a married person in the house, before you reach to the gate of your working place, you drop it. You enter. You finish the work. And when you reach back,
you pick
it again and go back to your house. But the problem is, some of us cannot bear it.
Yes.
A woman that is coming and say, yesterday, I was totally tired because I attended to more than how many people, and you are there. One patient to come in, just come and start insulting them as if, and talking, the nurse will say, hey, see me that I've been suffering, and this one is shouting. Not everybody will ignore it. Some people can ignore it. Because among the nurses, among the midwives, among the medicals, there are inborn medicals that you see, God created them as if this is where they're going to work.
Yes.
Among them, there are some of them that want to say, hey, I like to assist humans. So they come in and are still working under it. Among them that see there is money, I'm coming to General Hospital because in General Hospital, they are paying them very, not that they pay them very well, but at least they pay them more than the private ones. Though because of that, they see that there's money, and I have somebody that will just give me an appointment if I finish. They come in. And when the person comes and what he's expecting is not being achieved, he will not tolerate it. But the person that is inborn, and somebody asked me a question, which they say, when I entered, I noticed that you're already tired and wearied. I say yes, because I came back from work, I went to church. I said, but now, when you get up now, you stand, you see how you run to where get this and come back. I say, when you see somebody that can save his or her life, the strength will come from nowhere. Yes. So that is where the problem comes.
This is really, really, really appalling. Because if you think about several pregnant women going to the hospital to give birth, I'm even now seeing the main reason you're talking about lack of expertise, medical expertise, that's lack of people that really know what they're doing in the system. Because if you don't bring midwives that have underwent, trainings, and they've gone for different medical trainings, and they know all these things, it causes problem. Because I'm so certain in their schools, in the medical schools, they teach them temperament.
Yes.
Yes. So if they teach them temperament, definitely when coming into an hospital, a medical or place of delivery, and women are shouting and saying this, shouting at that, because pregnant women can be so frustrating too. When they are in labor, they can be very, very frustrating. Imagine you are pregnant and you are shouting at a nurse and even beating the nurse.
Yes.
You get it. You are beating the nurse. Leave me. All those stuff, those dramas. So if you are not somebody that underwent temperamental classes and all those things, you can't take them. So what first aid treatment would you advise us to take on pregnant women that, like, we normal people outside, we don't know anything about medical stuff, midwives? What first aid treatments would you give?
In labor?
Yes.
In labor? There's no first aid in labor.
Okay.
The best thing is there any facility around us?
Okay.
We take the person. Please, help me check what is the stage of the labor.
Okay.
If it's because the place she registered is so place, so that you will be able to say, with this stage, can she reach that place and deliver normally?
Okay.
Or will she deliver on the way? Then you allow them to deliver her. There's no emergency. You say, call this woman to come and deliver them at home. There's no emergency.
Sorry for cutting you short. What if in a situation whereby I'm in a house with my elder sister and she's in labor, serious labor, and there's no taxi around, nothing, and I'm the only person we had there? What do you advise me to do?
Unless you come outside and ask them, say, is there where I will get any nurse around this place?
What if I can't get nurse around?
You can't get nurse, but it's just to look for how to transfer the patient to what?
Okay.
To the hospital.
So what you're
because staying at home may cause problem.
Okay. So now what you're trying to tell us is that we as normal people can't take deliveries. We just have to take them to the hospital.
It's just like, because some people are taking delivery at home.
Okay.
But there's one case we had. The woman delivered at home. After delivery, they delivered the baby. They delivered the placenta cut. So the woman, they already have even happy that everything went successfully. But the woman started bleeding. And they check it, they check the outside, they say, there's nothing like any place that they are torn. No. You see it. Before you know, the woman becoming pepper white. When they later say, okay, let's look for a vehicle to go to the hospital, you see that the uterus is not even contracting. And because of that, to put hand, you see that half of the placenta retain inside. You see how it's the problem. But our people, when they deliver, another person delivered them successfully at home, they say it's God, the person know it. But you don't know it, because if you deliver, we have to say, midwife, you open the placenta to see. Is it complete? If it's not complete, you have to look for it. When we deliver, you as a midwife, the normal thing is in a running tap. You turn the placenta upside down and run the water to see, is there any lobes? Because placenta is in lobes.
Okay.
Is it complete? If it's not complete, immediately you start looking for it to remove it. Because even a small like this will cause that woman to bleed to death.
So
or some of them will even later develop one kind of infection that the woman will be smelling because the uterus will have issue.
That's bad.
So staying at home to deliver is not a good thing at all. But people do it, except under the supervision of any medical personnel. But if not, just it's just like somebody deliver at home. They say, okay, your wife that delivered, hey, deliver at home. We are just preparing. We never know that the thing is serious. So the baby came out, carry both the mother and the baby. Come to the hospital for them to do the checkup. We have to check, is there anything? And there's nothing. You killing the baby, give to them. They will go home.
Okay.
So emergency or no emergency, delivering at home will not be safe as such.
Okay. In just 3 minutes, can you just summarize and just give us an advice? What do you have to say to us? What advice do you have to give us as regards midwifery week? What would you tell us? What appeal would you like to make? Just give us anything you want to.
Seeing that this is midwifery week, I believe God of heaven that we are happy as midwives.
Okay.
Encourage us. We believe we are not waiting for our reward, just as the midwives in the Bible time. The Bible says God dealt well with them. We will not be looking at government, looking at human beings, looking at anybody at all. Our reward will come from them. God will reward every one of us and strengthen us as God has been helping us. Because during all these pandemics, it's only unfortunate ones at times that get infected of any of them. Because God has been helping us. Even delivering HIV patients, God will still protect us. And every case, God will help us and we will succeed and continue rendering the help to the public.
All right, viewers, we've listened to what Mrs. Violet Ofo has said, and we hope that the government also tries to provide all those basic facilities that we need in the hospitals, in the general hospitals, and all around the hospitals in the globe. So thank you, Ma, for joining us and making this journey so insightful.
Thank you very much.
Thank you. We hope to see you here more often.
By the grace of God.
All right, thank you for watching this video. This is a production of the Food and Health Communication, and a big thanks to our production team. Also, do make sure you follow our previous episodes for more of these videos and like our social media pages on Food and Health Com. Eunice Felicity for Food and Health. Stay safe.